If you or someone you love is taking amlodipine to manage high blood pressure or chest pain, you're not alone. It's one of the most commonly prescribed medications in the world. But while it can be incredibly helpful, it's not without risks. And some of those risks show up quietly, almost invisibly, until they become something more serious. In today's video, we're breaking down 8 side effects of amlodipine that you should never ignore. Not the mild ones your doctor brushes off, but the ones that could affect your comfort, your confidence, or even your safety, especially if you're over 50. These aren't just random symptoms. They're real signs your body may be struggling to adjust or quietly asking for help. We'll show you what to look for, why it happens, and what to do next. Whether you've been on amlodipine for years or just picked up your first prescription, this is the kind of information that empowers you to take charge of your health. Let's get started, because understanding your medication is one of the most important things you can do to protect your heart, your mind, and your independence. Side effect number 1, swelling in the legs and ankles. One of the most common side effects people notice with amlodipine, especially after taking it for a few weeks, is swelling in the lower legs, ankles, or feet. It might start out subtle. Maybe your socks leave deeper marks than usual. Maybe your shoes feel tighter in the afternoon. But over time, that puffiness can become more noticeable and more uncomfortable. This swelling, known medically as peripheral edema, happens because amlodipine relaxes and widens the blood vessels. That's how it lowers your blood pressure. But when the small blood vessels in your legs widen, fluid can leak into the surrounding tissue, especially if you're standing or sitting for long periods. The result? Fluid retention that pools at the lowest points of your body, your ankles, feet, and sometimes even your calves. This isn't just a cosmetic issue. It can lead to leg heaviness, discomfort when walking, and in some cases, a sense of pressure or aching that builds throughout the day. For older adults, this swelling can also increase the risk of falls or limit mobility, especially if it affects your balance or shoe fit. If you start noticing this kind of swelling while on amlodipine, don't ignore it. Let your doctor know. They might adjust your dosage, suggest taking it at a different time of day, or pair it with a mild diuretic to help move that extra fluid out of your system. Swelling may not seem serious at first, but it's one of your body's early signals that something needs adjusting. Side effect number 2, dizziness or lightheadedness. Have you ever stood up and felt the room spin? Or maybe you've taken a few steps and suddenly felt off balance, like your legs weren't quite under you. If you're taking amlodipine and have experienced this, it may not just be age or dehydration. It could be your medication lowering your blood pressure a little too much. Amlodipine is designed to relax your blood vessels, which helps reduce pressure on your heart. But for some people, especially older adults or those on multiple medications, that pressure can drop too far. When that happens, your brain may not get enough blood flow in those first few seconds after standing, and that's when dizziness hits. You might feel a little faint, disoriented, or even slightly nauseous. In more extreme cases, you could fall or need to sit down quickly just to avoid passing out. These aren't just inconvenient moments. They're warning signs that your dosage might be too strong or that your body isn't tolerating the medication well. It's especially important to take note if this dizziness happens frequently or if it occurs after standing up, getting out of bed, or after taking your pill. These patterns are valuable clues for your doctor. If you've noticed this side effect, don't try to power through it. Keep track of when it happens and bring that information to your next appointment. A simple medication adjustment or switching to a different drug could help you feel steadier, safer, and more confident in your movements. Side effect number 3, rapid heartbeat or chest pain. It might sound surprising, but some people who take amlodipine, a drug meant to support heart health, report a racing heartbeat or chest discomfort. This feels confusing, especially when the medication is prescribed to prevent those very symptoms. Here's what's happening. Amlodipine relaxes and widens your arteries, which helps blood flow more easily. But for some individuals, this sudden change in blood flow causes the heart to react by beating faster than normal. Your body is trying to stabilize itself, but in doing so, your heart rate may jump unexpectedly. You might feel a flutter in your chest, a thudding heartbeat, or a quickened pulse that comes out of nowhere. In other cases, people describe it as a pounding sensation that makes them anxious or uncomfortable, especially at rest. Now let's talk about chest pain. For most people, amlodipine actually reduces chest pain caused by angina. But in rare cases, especially when starting the medication or increasing the dose, it can briefly cause a worsening of symptoms. This is more common in people with severe heart disease or those sensitive to blood pressure changes. So what should you do if you notice these symptoms? First, stay calm. Not all chest pain means a heart attack, but don't ignore it either. Take note of when it happens, how long it lasts, and what you were doing before it started. If your heart is racing regularly or chest pain becomes frequent, contact your doctor. Your heart's rhythm matters, and any change, fast, irregular, or painful, is worth checking. Side effect number 4, fatigue and weakness. You wake up in the morning and feel like you barely slept. Simple tasks feel heavier. Maybe you're dragging through the afternoon, canceling plans, or just not feeling like yourself. If this sounds familiar and you're on amlodipine, the medication could be playing a role. Fatigue is one of the more underreported side effects of amlodipine, but it's surprisingly common, especially among older adults. The reason? When your blood pressure drops, even just slightly, your brain and muscles may not get the oxygen-rich blood they need to function at full strength. This can leave you feeling sluggish, slow to move, and sometimes even mentally foggy. You might struggle to finish your daily chores, lose motivation to exercise, or feel like your energy just isn't there anymore. What makes this tricky is that fatigue can come from so many causes: poor sleep, stress, diet, aging, or other health conditions. That's why people often overlook the connection to their medication. But if this change in energy started after beginning amlodipine or worsened when your dose increased, it's worth paying attention. Another factor could be how your body processes the drug. Some people are more sensitive to changes in circulation, especially if they're on other medications or have underlying health concerns like anemia or thyroid issues. You don't have to accept constant tiredness as your new normal. If this fatigue is interfering with your quality of life, bring it up with your doctor. A dose adjustment or medication switch could make a world of difference in how you feel day to day. Side effect number 5, flushing and feeling hot. You might be sitting quietly, reading a book or watching TV, when suddenly your face feels hot. Your cheeks turn red, your neck warms up, and you start to sweat a little, even though the room is cool. No fever, no emotional stress. Just this sudden, uncomfortable flush. This is something many people experience with amlodipine, and yet very few talk about it. It's called flushing, and while it may not sound dangerous, it can feel distressing, especially when it shows up often and without warning. Here's why it happens. Amlodipine is a calcium channel blocker, and its job is to relax and widen blood vessels so your blood flows more easily. That's good for your heart, but when blood vessels near the surface of your skin expand too much, it increases blood flow to those areas, especially your face, neck, and chest. That's when you start feeling hot, flushed, and maybe even a little embarrassed. Some people describe it as feeling like a heat wave from the inside. Others say it comes with a pulsing sensation in the head or ears, almost like their blood is rushing. And for some, it can even trigger light sweating, making things more uncomfortable, especially in social situations. Now, flushing may seem harmless, and in most cases it is, but for people over 50 who may already be dealing with other changes in the body, like hormonal shifts, blood pressure fluctuations, or medication sensitivity, it can be frustrating and confusing. Worse, it's easy to mistake flushing for something else: high blood pressure, a panic attack, or even a reaction to food or alcohol. That's why it's so important to recognize the pattern. Does it happen shortly after taking your pill? Is it more common in the evening or during physical activity? Does it go away on days when you forget a dose? If you find yourself frequently overheating, turning red, or avoiding activities because of how you feel, don't ignore it. Talk to your doctor. They may lower your dose, recommend timing adjustments, or suggest an alternative medication that doesn't cause flushing. You don't have to live with daily discomfort or worry about suddenly turning red in the middle of a conversation. When your medicine works for you, it should bring relief, not bring on symptoms that make you shrink away from life. Side effect number 6, swelling of the gums. Imagine going about your day, brushing your teeth like usual, when you start to notice something odd. Your gums feel puffier than normal. They bleed more easily. And slowly over the next few weeks or months, your smile begins to change. Your teeth look smaller. Your gums seem to be growing over them. And it's not your imagination. This little-known side effect of amlodipine is called gingival hyperplasia, or gum overgrowth. It's not just a rare quirk. It's a documented reaction that can happen in a surprising number of people, especially those who've been on amlodipine for several months or more. Here's how it works. Amlodipine relaxes your blood vessels, but it also seems to stimulate certain cells in your gums to grow excessively. This tissue builds up around the teeth, most commonly in the front, either top or bottom, and it can create an uneven, swollen look. At first, it might not bother you, but over time, this gum growth can interfere with brushing and flossing. Food may get trapped more easily, inflammation increases, and in some cases, this leads to deeper oral infections, cavities, and even loose teeth. For people who wear dentures or dental appliances, the changes can affect how those devices fit, making eating or speaking more difficult. It's not just about appearance, it's about health and comfort. And unfortunately, this side effect often goes unnoticed until it's progressed too far. So what can you do? First, let your dentist and doctor know as soon as you notice changes in your gums. Good oral hygiene becomes even more important when on amlodipine. Regular dental cleanings, gentle brushing, and flossing can slow down the progression. In more advanced cases, your doctor may recommend switching you to a different blood pressure medication that doesn't affect gum tissue in the same way. In rare cases, a dental procedure to remove the excess gum tissue, called a gingivectomy, might be needed. What's important is that you don't ignore it. Many people live with gum discomfort or embarrassment without realizing it's linked to their medication. But now that you know, you can take action early and protect your smile, your comfort, and your confidence. Side effect number 7, trouble breathing. Breathing is something most of us don't think about until it becomes difficult. If you've ever felt short of breath, like you can't quite get enough air, or find yourself huffing and puffing during simple tasks that used to be easy, it's time to take a closer look. For some people, amlodipine may cause or worsen shortness of breath. This side effect can show up in different ways. You might feel winded walking upstairs, needing to pause more often during a stroll, or waking up at night feeling like you can't catch your breath. But why does this happen with a blood pressure medication? There are a few reasons. First, amlodipine can cause fluid retention, especially in the legs and ankles, as we discussed earlier. In some cases, this fluid doesn't just stay in your lower limbs. It can slowly back up into your lungs, making it harder for oxygen to circulate properly. This is especially true in people with underlying heart issues. If your heart is already weakened or working harder than it should, amlodipine might shift the balance just enough to tip your system into shortness of breath. Another possibility is that your blood pressure drops too low and your body reacts by breathing faster to compensate. This can lead to a feeling of anxiety or tightness in the chest, even when you're at rest. Regardless of the cause, trouble breathing is never something to ignore. It's your body's emergency alarm system. And while it might not always point directly to amlodipine, it's a clue that something in your medication plan or your health overall needs to be reevaluated. If you notice increased breathlessness since starting amlodipine, especially if it's paired with swelling, fatigue, or a racing heart, call your doctor right away. In rare cases, difficulty breathing can also be part of an allergic-like reaction, which may include facial swelling or throat tightness. A medical emergency. You deserve to breathe freely without discomfort or fear, and if a medication is standing in the way of that, there are always other options. Side effect number 8, mood changes or depression. Sometimes the effects of a medication aren't felt in the body, but in the mind. If you've been feeling more down than usual, less interested in the things you once enjoyed, or unusually irritable or anxious since starting amlodipine, it might not be just life or just aging. It could be your medication quietly affecting your mood. Although not as commonly discussed as swelling or dizziness, mood changes and symptoms of depression have been reported by some patients taking amlodipine. These effects can be subtle at first, maybe a little more emotional than usual, a shorter temper, or trouble focusing, but over time, they can build into something more noticeable. For some, this shows up as a low mood that lingers throughout the day. Others feel emotionally flat, like they're just going through the motions. In more serious cases, feelings of hopelessness, sleep changes, or social withdrawal may develop. All classic signs of depression. Why would a heart medication affect your mood? The answer isn't fully understood, but there are a few possibilities. For one, amlodipine alters how blood flows throughout the body, including to the brain. In people who are sensitive to changes in circulation, this can sometimes lead to fatigue, brain fog, or changes in emotional regulation. Also, when blood pressure drops too low, it can affect energy levels and disrupt normal chemical balance, both of which play a role in mood. And let's not forget that medications affect everyone differently, especially as we get older, and our bodies metabolize drugs more slowly. What's important is not to ignore these changes or blame yourself. If you notice a shift in how you feel emotionally, track it. When did it start? Has it gotten worse? And most importantly, did it begin after starting or changing your dose of amlodipine? Speak to your doctor openly. Mental health is just as important as physical health, and feeling emotionally off could be your body's way of asking for help. There are other blood pressure medications that don't carry the same risk, and getting the right one could help you feel more like yourself again, inside and out. So now you know, amlodipine may help control blood pressure, but for some people, especially over 50, it comes with side effects that are easy to overlook, but too important to ignore. We've covered 8 key signs: swelling in your legs, dizziness, racing heartbeat, fatigue, sudden flushing, gum overgrowth, breathing issues, and even mood changes. Any one of these could be your body's way of saying, this medication might not be the right fit. If you've noticed any of these symptoms in yourself or someone you care about, don't wait. Track what's happening. Talk to your doctor. There are always options, and your comfort, clarity, and safety matter. At MediMint, we believe you deserve more than just a prescription. You deserve to understand how it works, how it affects you, and how to speak up when something doesn't feel right. If you found this video helpful, give it a like and share it with someone who might need it. And if you haven't yet, subscribe to MediMint for clear, trusted health information made just for you. We're here to help you feel better, think clearer, and take control, one video at a time. See you next time, and take care.